I'm Laura Benzel, and I'm one of the health equity leads at iPro. We have actually several people who are very knowledgeable in health equity who have collaborated on this series. So appreciate all of the help and so glad that you're all here today. So I'm almost positive everyone is familiar with Zoom at this point, but just a reminder that you can find the chat button at the bottom. We'd love to hear from you in the chat. We'd appreciate just if you could stay muted until we get to the Q&A session, and then we're happy to take questions live. In other words, you can come off mute and talk to us that way. But in the meantime, feel free to enter questions or comments in the chat. My colleague, again, Pooja, will be monitoring the chat for us. So probably, especially if you've been on the series, you know that iPro is the QIN-QIO, or Quality Improvement Organization, for these 11 states and the District of Columbia. In addition, we are also the HQIC in these 12 states. Pooja is going to be putting a link in the chat with about our website if you'd like to get more information about our work. So today is Category 3 is what we'll be covering. This is data validation, which is an important part of doing patient demographic data collection. So we'll be talking about this, and we actually have a guest speaker, Ruth Hendricks, who will be talking about her hospital's journeys in doing data validation. So just a quick overview of the purpose of this presentation or this series. Many of you probably have seen this if you've joined us in the prior sessions, but if this is your first attendance in this series, the reason that we're doing it is to help organizations to identify opportunities for improvement in your ability to collect, validate, stratify, and analyze patient demographic data. Now, we distributed what was called an health equity organizational assessment. Many of your organizations did complete one, and we turned around a report and sent that back to you. If you haven't completed an HEOA, that's completely fine. No worries, you're still welcome to attend all 7 sessions of our series. So we're going to start with a polling question. We'd love to know if your organization has a standardized process in place to evaluate the accuracy and completeness of patient self-reported demographic data. Yes, no, or I don't know. We'll give you a few minutes here, or a few seconds to respond. Okay, Ryan, do we have responses? So we have about an even split on the yes and no's about validating data, and actually an even split across all 3. Some folks don't know, some are not validating data, and some are. So that's good to know. Thank you so much for sharing that information. So the reason we're talking about this particular topic is that validating data that's been collected and self-reported by patients is considered a best practice. It's encouraged that you have a standardized process in place to evaluate the accuracy and completeness of patient demographic data. So the recommendation is to consider these following questions. I'm not going to go through all of them. I'm putting them here on the slide so you have them after our presentation today. And also we have a resource that also includes all of these questions, but just some, for example, you want to ask, did the patient and caregiver self-identify the data? That's the standard recommendation or best practice. Are there differences in the data that we're collecting from different collection points? So for example, if what we're collecting at the registration point is different from discharge, we need to understand about those discrepancies. As far as completeness, the recommendation is that you're collecting real data for 95% of your patients, and you want to ensure that the unknowns or unavailables or declines are less than 5%. So these are some questions to consider as you consider the validation of your data. Couple other things to also, or 3 other things to consider is uniqueness. Are you ensuring that your patients are represented only once in all of your records? How often are you updating the data? And also, you want to ensure that the patient data that you're collecting is consistent with your patient population. Again, if there's a discrepancy there, you want to explore why that is occurring. So again, if your organization completed a health equity organizational assessment, you may have received a report from us that looks like this. And this particular snapshot is obviously from Category 3 data validation. And this particular organization is doing a great job of validating data because they checked and self-identified that they are doing all of these key activities. And this actually comes from Northern Light Hospital, and that's our guest speaker today, Ruth Hendricks. So again, these are the elements that are considered to be important for identifying and addressing disparities through national research. This is the resource that I mentioned that we have in our resource library, and we will have the link for you closer to the end of the presentation. And this resource covers all 7 categories of the HEOA. We talk about the best practice, and then we actually give you more detail for each of the best practices about recommendations of how to implement that. So if you received your report and there are areas of opportunity, for example, for data validation, you may want to consider hopping into our library, looking at this resource, and looking at the steps that are considered or recommended for, for improving that process. We also include several resources that you will also find helpful. So we have another polling question here. Does your organization have a standardized process in place to evaluate and compare patient self-reported demographic data to local community demographic data? So we'll give you a few seconds to respond to that. Okay, Ryan, do we have some responses? So about 33% say yes, 20% no, and then we have about 47% who don't know. Thank you, that's great to know. That's good information. We appreciate you sharing. So we're really happy to welcome Ruth Hendricks, who is the Director of Organizational Quality and Risk at the Northern Light Sebastian-Cook Valley Hospital in Maine. Ruth, thank you so much for joining us. Welcome.
Sure, thanks for having me.
So tell us a little bit about Northern Light Sebastian-Cook. Can you give us the elevator pitch about your hospital?
Sure. So we're a 25-bed critical access hospital. We're located in central Maine. The hospital was established in 1963 by a group of community leaders, and it serves an area encompassing a population of about 40,000 people in central Maine. We have both inpatient and outpatient services, including a surgical unit, medical surgical unit, and special care unit. We also have continuing care, so swing beds. We have a women's health care center, rehab centers, and then primary and walk-in care medical offices across our organization. And we have different towns that we represent, as well as 20 specialty services.
Great, thank you. Tell us a little bit about your role. What are your responsibilities as the Director of Quality and Risk?
Sure. So I'm sure, like many of you, there is a lot enveloped into quality in itself, and then add risk on top of it, and you have even more. But to summarize, I really have oversight of the development and implementation of our quality and performance improvement program. I assist in developing metrics and quality to ensure that all policies and procedures comply to maintain a high level of patient care. Being part of a healthcare system, a lot of that flows over from organization to organization, and a lot of our key performance indicators in reference to quality are system wide. I also assist in any corrective action, if patients or visitors have any complaints or concerns, assist in remedying those.
Great, thank you.
Sure.
So Your hospital did really well in the organizational assessment. You scored really great in all of the categories. So to me, that obviously shows a commitment to health equity in your hospital. Are you involved in the implementation of those procedures?
Yes. Yep.
Okay. So particular to data validation, we just went through some of the best practices, and again, you scored really well. So what is the process? Can you share what the process is that your hospital goes through to validate that data?
Sure. So it's really, screening and then connecting individuals to any services and then closing that communication loop, but really tracking outcomes associated with both the real and SDOH data to ensure that we're covering all bases there to remove those healthcare disparities.
Great, thank you. So your hospital is comparing provider collected real data and social determinants of health data to community demographic data. You saw in our poll that some hospitals are not doing that. Can you talk a little bit more about that process?
Yeah, so we obviously with the real data examine race, ethnicity, and language, while also focusing on the conditions and environments where people are born, where they live, where they work, play, worship, and then their age, because they all affect a range of health, functioning, and quality of life outcomes and risks. We examine this data together because we can use this information in planning public health promotion, prevention, treatment, and management strategies. Really comparing these two sets of data can inform planning activities for partners across all healthcare sectors related to education, transportation, housing, because we all have the shared goal to improve the conditions in people's environments and their health.
Great. So you're screening for social determinants of health, and then you're actually connecting patients to services in the community.
Okay. Correct.
Yeah.
Yep.
Is all of that tracked in your EHR? Do you know, like your track to referrals and the outcome? Oh, great.
Yeah. So that's kind of how we validate that our process is working. So we're, one, making sure that we're capturing that, but two, making sure that that communication or that loop is closed.
Great. I'm going to pause and ask Pooja if there are any questions in the chat for you, and also invite folks to come off mute and ask any questions of Ruth and her process at her hospital.
Hey, Laura, no questions thus far.
Great. So if anyone would like to come off mute, feel free to do so and ask Ruth any questions about the process for data validation. This is important. I think we were trying to emphasize that it's one thing to collect the data and also, have it in your records. But if you're not validating, again, to make sure that 95% of patients are ensuring that, that you have the data for 95% of the patients, it really can hinder your ability to identify and address those disparities. So I'm assuming that that's something that you've achieved, that you're ensuring that you have collection for 95% of your patients. Okay, so I'm going to stop and see if anyone wants to come off mute and ask any questions. So Ruth, are there any challenges or best practices? I guess challenges are more interesting in implementing this process that you can share with folks that they maybe can learn from.
I would say not necessarily a challenge, but it could pose a challenge. I guess just utilizing your electronic medical record to its fullest potential really breaks down some barriers. So what I mean by that is making sure that the workflow in capturing this data makes sense to the people who are capturing the data. So if it's the registration folks, making sure that they have the right workflow and that you're open to their ideas and communication with any barriers that they have.
What type of EHR does your hospital use? Cerner?
Yeah, okay. And so there is a question, if registration, yes. So registration does pre-registration. We also have patient portal, so the patient can self-report. So rather, we used to have the kiosk system, but we're really encouraging the patient portal.
Great, that's a good question. So last week we covered data collection training and how important that is to make sure that staff understand, first of all, why we're collecting this data, and so they can communicate the importance of that to the patients. Have you found that that's been an important step as far as this process of collecting the patient demographic data?
Definitely. So I think at first, educating our staff as to why we're doing this, but also more importantly, so that they can educate our community and our patients as to why we're asking these questions. I think transparency is big, and really answering the whys associated with what we're doing.
Yeah. Anyone in the audience have any other questions about data validation? We actually, so far we've covered data collection, why that's important, data collection training, and then today validation, and all the presentations and the recordings are out on our website. So if you want to go back and refer to them, we'll have a link for that a little bit further here in the presentation. And again, we're recording today's presentation as well. So we recommend that after our presentation today, really to leave an action, and what are some steps that you can take to implement the best practices that we've talked about today. Well, again, we have that particular resource that I just showed you that is in our resource library, along with several other resources that we've developed around the health equity organizational assessment. So we recommend that you click on this link and go to the resource library. Also, I'm encouraging you to attend the educational series. Today is the 3rd of 7, and then we're going to have a wrap-up session on August the 6th. So we hope that you'll continue to join the series and come with your questions. Feel free again to come off mute and ask any questions if you have any, or any comments. If you did an HEOA, we encourage you to review your report and develop an action plan. Pick one category and see where there's an area for opportunity for improvement, and pick that one best practice or action and implement that, and then move on to the next category. And as always, iPro is here to help. Feel free to reach out to us with questions or comments or needs. So this is the link to the library. These are all of the resources that we have available to support the HEOA, but the library is very extensive. We have many other resources out there all around the quality improvement work that we're doing as part of our contracts with CMS. So if you go to the library, there's a list on the right-hand side by category, so you can click on those and look at all the resources. This particular link will take you directly to the resources for the HEOA. This particular link will take you to the registration for all of the sessions for this series. Again, we're on data validation, and these are the remaining sessions. Next week, we do have a guest speaker to talk about data stratification from Athol Hospital in Massachusetts. So we'll hope you'll join us and come with your questions about data stratification. If you have any questions, if you would like to take the HEOA, you're welcome to do so. Your quality improvement advisor can send you a link. You fill it out in REDCap, and once you submit the assessment, we will generate a report and send that back to you. If you're not sure who your advisor is, feel free to reach out to Stacy or myself. Here's our email addresses, and we're happy to hook you up with the person that can send you the link to the HEOA. Also, feel free to go to our website. If you go to the iPro website, there is a drop down under About Us, and you can see information about our HQIC contract and information about the QIN-QIO contract. We also have a section specific to health equity. We generate monthly newsletters. The July issues were just posted, so you can find those on our website. They have good information relative to health equity. I'm just going to stop real quick, Pooja, and see if there are any questions or comments in the chat.
No questions. There's a nice comment to Ruth for sharing her presentation, and thank you, Ruth, for providing your experience and sharing it with everyone.
Thank you. So we will actually be sending out a survey after the session. I believe it automatically pops up onto your screen. Also, it'll come to you through email. We'd love to get your feedback on the sessions or any other topics that you'd like us to cover in the future. We would love to hear your feedback. And also, thank you so much for all that you do around health equity. Again, that's my focus. So I'm always excited to see people attend and listen to our conversations around health equity. We're ending a little early here today, so we're going to give you back some of your time. Thank you, Ruth, so much again for joining us today. We really appreciate it. And everyone, have a great day.